Good afternoon to everybody. So you have the title of my presentation, and the two economic models, socialist economic models that I am going to discuss are first Cuba. Cuba is one of the few countries, along with North Korea, that still have a central plan. And it's also, there is a domination of the state-owned large enterprises over the market and private property, along with mild structural reforms oriented toward the market that have been unable to generate economic growth, as we are going to see, resulting instead in two significant crises. The worst have been going on for 4 years now. And the other model is a sign of Vietnamese socialist market. It's a mixed model that combines dominant small, medium, and some large enterprises, and the market, which is predominant. And they have a decentralized plan. It's not a central plan like Cuba, but more a guideline for development. And the state regulates the economy and control the largest state enterprises, most of which are state-owned. Concerning aging, the percentage of the population 65 years and over, Cuba is the oldest country with 15.7%, followed by China, 13.7% in second place, and Vietnam is the youngest country with 8% of the population over 65. And here you have a figure which shows the economic growth, the GDP annual average growth rate in constant prices in the period 2009-2020. As you can see, China, which is in the blue curve, have the best performance, followed by Vietnam, which is in the yellow curve, and finally, well below is Cuba with the red or orange curve. As you can see, there is a slowdown in economic growth, but while in the case of Vietnam, China and Vietnam still is positive, 2 and 3% respectively. In the case of Cuba, there is first a stagnation in 2019, and then a sharp decline in economic growth, 11%. So in terms of economic performance, China, Vietnam are doing well. Cuba, just the opposite. Well, we have also different healthcare systems. Cuba has a unified public system, which is totally state financed. This system, at least in theory, is universal and gratuitous. That was true until the end of 1990s, 80s, excuse me. But then, because of the collapse of the Soviet Union and Eastern European socialist economies, Cuba suffered the first crisis. And so there have been an increasingly deteriorated healthcare system. The current crisis that you saw before started in 2018 and continues today. Cuba neither have private facilities nor private practice. So physicians, nurses, etc., they cannot practice medicine on their own. They have to work for the state. China is a more complicated system. We have 3 healthcare schemes. The first one is mandatory for urban and rural employees, and it has 2 tiers. The first is basic social insurance, and the second is individual accounts, which are owned by the insurer. In the first case, it's a collective public system based on pay as you go. The second tier is voluntary, or scheme is for urban and rural residents. and it provides only basic insurance. They don't have individual accounts. And the third scheme is a military with its own hospital and medical staff. China have both private facilities and practice, so it's a mixed system of public and private. And finally, in Vietnam, you have public social insurance, relatively unified, mostly state financed, but there are co-payments, and there are private facilities and practice. So Vietnam is more like China, except that it doesn't have individual accounts as in China. How do we measure healthcare performance? In this table, what I have done, I have selected 15 indicators. The first group is the inputs indicators. And the second one is the outputs. And then at the end, we have the financial sustainability of the system. In the case of coverage of the population by the healthcare system, there are no data for Cuba, but it's almost universal in China, 96.6, so we rank China first. And Vietnam follows with 88.8, we rank it 2. In this case, it's the only data that we are missing in the entire table, and therefore we don't have 3. We don't have the data for Cuba, so we only have rank China, Vietnam. Then another indicator is physician per 10,000 inhabitants. As you can see, in this case, Vietnam is ahead with 8.8, so it's 1 first, followed closely by Cuba with 8.6, and China is the worst with 2.0. One important thing is that I have compared the changes between 2008 and 2019. And for instance, the number of hospitals in Vietnam increased by 89% in this period. So it's the first country ranked, followed by China with an increase of 79%, but Cuba have a decline of 32%. And this is the result of the deterioration that I explained after 1989 with the first crisis, and now worse with the second crisis. And now you have the same in the number of physicians. In this case, there is an increase of 89% in Vietnam, 79% in China, but only 39% in Cuba. So it's one. First, second, and third. We have the same in the case of nurses. In the average days of hospital stay, the first is Vietnam with 6.6, followed by Cuba 7.4, and China with 9.5. Well, now the outputs. The infant mortality rate, Cuba and Vietnam are fairly close. Cuba have 5 deaths per 1,000 born alive. So it's the first, and China is 5.6, is the second, and Vietnam is the worst with 13.9, is the third. But there is an important addition here, which is that in Cuba, the infant mortality it's not declining, it's increasing. The signs are the opposite. And in China and Vietnam, the trend is towards decline. So eventually, if the current trend continues, China and Vietnam will improve over Cuba. And the same is true in the maternal mortality rate. The Cuba is the worst, 177, and it's, again, the sign is the opposite. It's increasing, and the best is China with 17 and increasing and decreasing too. And I left for the end the very 2 important indicators, which explain the financial sustainability of the system. In the case of Cuba, there are no healthcare contributions over wages, neither from the workers, not from employers, because it's a public system totally financed by the state. In the case of China, you have 16%, the total contributions of employers and employees, which is the first country, and then comes Vietnam with the second, 9% contribution on wages. On the other hand, health expenditures, as you can see, are the highest in Cuba. It's almost 12%. So there is zero contribution, but there are almost 12% expenditures as percentage of GDP. In China, there is a positive gap because the contribution 16% are considerably higher than the health expenditure 2.1, and the same is true, but the gap is smaller in the case of China. Let me show you here a figure that presents the situation. Note that in China you have 16% contribution, that's the blue bar, and then you have 2.1 expenditures as a percentage of GDP. So you have a big gap here, a surplus. In the case of Vietnam, you also have a surplus, but it's smaller. In the case of Cuba, you have a deficit, zero revenue and 11.9%. So going back to the performance, what we did here is we added up all the rankings and the score. The total score are 34 for Cuba, 20 for China, and 28 for Vietnam. The lower the score, total score, the better. So the ranking is first China, second Vietnam, and Cuba are lagging behind. And then you have the ranking, which is the total score divided by the 15 variables. And as you can see, China is first, 1.33, followed by Vietnam with 1.87, and Cuba lagging behind with 2.43. As you can see, the range is 3 percentage points, and the difference between Cuba and Vietnam is 1.1 percentage points. Now, let's, we are about to finish. Let's talk about aging and the financial sustainability. We have seen that Cuba is by far the oldest country of the three. We saw that in the percentage of population 65 and above, but there are other figures such as the fertility rate. And it is projected that by 2050, Cuba will be the oldest country in the world, along with Japan. As a result of this is a positive thing because people are living longer, but in terms of healthcare and pensions, that results in much higher costs. People in the old age, they have diseases that are much more expensive to treat than in young and middle age. And therefore, and also you have terminal and chronic diseases, which makes the whole healthcare system much more expensive. And this, because of aging, this healthcare cost will substantially increase, making the system unsustainable. Cuba have begun to implement a few programs to try to raise the fertility rate, but so far, we are talking about 6 or 7 years, the fertility rate continues to decline, and the segment of the population which is elderly continues to expand. So structural economic reforms are needed in Cuba to reverse the decreasing economic growth. China is the second oldest country of the three, and there have been recent policies introduced to incentivize the birth rate. For instance, China for 3 decades, limited the number of children that a couple could have to 1, and more recently expanded it to 2 and then to 3 children. But it's too soon. This policy has been in operation for about a year and a half or 2. It's too soon to assess the results. And finally, Vietnam is in the best situation here because it's the youngest country and therefore has a window of opportunity to design policies to cope with aging and reduce or control the cost of healthcare. And my conclusions, and with this I end, Cuba is the oldest of the 3 countries, and its healthcare system is financially unsustainable. It lacks a window of opportunity. That window of opportunity already passed. It's, by the way, the oldest country in Latin America as well. And this is in large measure the result of its poor economic performance. We saw that in the figure. There is a crisis, a second crisis in the last 30 years. And therefore, it needs to improve its economic model and healthcare system. And this is a summary of a few chapters of a book that is coming next year. And I show the lessons of the socialist market model of China, Vietnam, and how Cuba could improve significantly by changing both the economic model and the healthcare system. China economic growth is the highest in the world, and its health care system has performed better than Cuba. It is financially sustainable in the medium term, but aging will increase healthcare costs in the long run. And hence, China needs to design proper reforms to raise the fertility rate and to improve the efficiency of the health system. And finally, Vietnam is the youngest of the 3 countries, have a good performance in health supported by high economic growth. Therefore, its health system is financially sustainable in the midterm. It has a window of opportunity the other 2 countries don't have to design and implement policies that consolidate its healthcare system. Thank you very much.
Hello, Professor.
Hi.
Mesa Lago. My name is Alex Costley from USA, New York City. I know you're in Pittsburgh. I think many people in the US are very fascinated by Cuba. When I look at your data, what really stood out in terms of the changes you mentioned is Cuba, the number, it looked at, was that percentage, a negative number of hospitals over a 10-year period. And Cuba was the only one with negative number. Does that mean hospitals are being closed or shutting down?
Yes, in 2007, President Raúl Castro, that followed Fidel when he got sick, he made a speech in which he acknowledged that the cost of social services was extremely high in Cuba, and it could not be supported by economic performance. And therefore, there was a plan to reduce social costs. And one of that includes pensions, healthcare, education, housing, and social assistance. And therefore, there was a significant reduction. They also tried to consolidate hospitals. So all rural hospitals that was an important improvement that revolution brought up. Rural hospitals were shut down in 2011, and also polyclinics. And the only thing that kept raising was the number of physicians, because Cuba main hard currency revenue comes from selling healthcare services to foreign countries. So the number of physicians have been growing up, but all the indicators are coming down. By the way, all this data that I have presented comes from the statistical yearbooks of the 3 countries. There are no estimates. These are hard figures given by the three countries.
So I guess my other question is, what also stands out for Cuba, as you said, contribution is zero from individuals. So what is the source of funding for healthcare in Cuba?
Yeah, I explained at the beginning that Cuba have a public healthcare system. It also have a public pension system, but it's peculiar because you don't have even a reserve. Usually some countries, we call this pay as you go. So the state finances the pension system, but there are contributions in the case of pension. In the case of healthcare, there are no contributions from workers and employers. So the state finances the whole system, and it does it out of general revenue, taxes. There is no segregation of how much of the taxes are assigned to healthcare. But what we know is that there is a deficit. And the same thing I have documented in the case of pensions. In other words, the revenue coming from the system is lower than the expenditures, and that deficit is expanding because of the aging process.
I'm just curious, what taxes exist to fund a healthcare system in Cuba? What's being taxed?
Well, the major problem, and I didn't have time to go into this, you must realize that this is a very brief summary of a book that has 300 pages.
Oh, okay.
The Cuba model of central planning is obsolete. This is what we had all over the Soviet Union and Central and Eastern Europe before the collapse of the socialist camp.
Yeah.
As I said, there is only one country that I know that have the same system, which is North Korea. The difference between Cuba and North Korea is that Cuba, under Raúl Castro, introduced market-oriented reforms that North Korea have not done, as far as I know. The problem was that was a positive step because it seemed at the time that maybe Cuba would follow the Sino-Vietnamese approach. But unfortunately, these reforms were very timid. There were a lot of restrictions, very heavy taxes on the private sector. There were inspections that shut down the private sector, many enterprises in the private sector, and there were zigzagging policy. Actually,
oh, sorry.
Actually, excuse me. Actually,
I can hear you.
In 2016, the whole reform process was stopped. So that resulted in the economic crisis of the 1990s, but that was mainly caused by the collapse of the Soviet Union. By the collapse of the Soviet Union, and the present crisis, which is the worst since the Great Depression, that is mainly a result of the failure of those market-oriented reforms. So in order for Cuba to improve the healthcare system, it has to change its economic model. And what I show in my book, and I show here only one indicator, that is GDP growth, is that the Chinese and the Vietnamese model have performed much better than Cuba. Now, I did know before starting to work in the book that the economic performance of China and Vietnam was better than Cuba. But what surprised me, I have been working on Cuba for 65 years. What surprised me was that both the Chinese and the Vietnamese have first match Cuban social indicators and then exceed Cuban indicators. And this is even more important because Cuba, before the revolution of 1959, and there is ample documentation about this based on official statistics. Cuba was one between the first 2 or 3 countries in Latin America, both on economic indicators and social indicators. At the same time, Vietnam and China were very underdeveloped countries at the time of the revolution. So Cuba has an advantage to start with over the 2 other countries because it has performed much better and was at a higher level of development. But the model, the market socialist model or socialist market model of China and Vietnam have performed much better and have been, their effort has been so that they are now exceeding Cuba not only in economic indicators, but on social indicators as well, including healthcare.
Okay, thank you very much.
You're welcome.